Good.
Good, Mr. Chair.
All right. Good morning. It is 10:01 a.m. Of October 24th, 2023, and I'm calling the Texas Behavioral Health Executive Council meeting to order. My name is John Belamowitz, and I'm standing in today for Chair Canseco. Daryl, will you please call the roll for us?
Sure, sir. Gloria Canseco, Chair. She's absent. Chair Belamowitz.
Present.
Mr. Brumley, Chair Brumley.
Present.
Dr. Cartwright.
Present.
Chair Hallbauer.
Present.
Ms. Rogers. I haven't heard from Ms. Rogers yet, Mr. Chair. Dr. Scoma. And Dr. Scoma will be absent. He's already emailed. Ms. Smith.
Happily here.
All right. And Dr. Taylor. I haven't heard from Dr. Taylor. Chair Hallbauer, have you?
I'm not. I will shoot him a quick text.
Okay. You got a quorum, Mr. Chair.
Very good. I'll come back to the motions in a minute for absences. In the meantime, I'm going to turn it over to Daryl to go over informational items. Point 3.
All right.
Thank you, Mr. Spinks.
Okay, if you look in the, I'm gonna try to be brief this morning because most of this, the documents speak for themselves, so I don't want to belabor the point, but you can look, we've got our annual and quarterly fourth quarter performance measures for fiscal year 23. Everything's looking good in there. The one area where I think, I personally feel like we probably need a little bit of improvement. It's not a bad thing. I just think it can be improved on. And that's going to be the average time it takes to resolve a complaint. That's at about 300 and something days. That went up just a little bit from the quarter before. The 300 is a yearly average, but you know, I think we can probably. My goal is I want to get us down to 180 days on resolution of complaints. Now, I will tell the council and the public who are listening that I don't think we're ever going to get down to days like 10 and 15 and 20 days to resolve a complaint. I just, you can't investigate and resolve a complaint against a mental health practitioner or a professional like what we deal with here that fast. It's not going to work that way. So I think probably if we can get somewheres in the, you know, right around 180 days, I think that's going to be the optimal time. That's going to be about as good as we're going to get on that. So that's what we're going to shoot for, Patrick and I and Mr. Fernandez, the division manager for enforcement. We're going to be meeting to see what we need to do, what if any changes need to be made so that we can hit that mark. So I'll be reporting back to you at our next meeting in February, kind of what our findings are there and what steps, if any, we have taken in the interim to try to get us to that mark. But other than that, I don't really have anything else to report on those annual and quarterly performance measures. But I'll entertain any questions if you have any. Okay, hearing none.
Oh, hang on, Ms. Smith.
Yes, ma'am.
You know, I'm always going to have something. Can you let us know, because the public is also listening, can you let us know the steps that you have taken to make it go down? And what do you see that caused that bump that happened?
Yeah, the steps we have taken kind of harken back to the days when we set up BHEC. The biggest thing we did, we had enough investigators and we had enough attorneys. That's what's allowed us to get those numbers down. Now, I think what we're seeing now, why we're seeing kind of an uptick, is that we're through a lot of the easy stuff. And now we're just into the big, nasty, hairy stuff. And those just naturally take more time to resolve. So, you know, that's going to naturally is going to increase your average resolution time. That's what I think is going on, but that's kind of also the purpose of my meeting with Patrick and Alfonso this week, is to try to figure out, get their take on what do they think is going on here and what can we do to resolve it. So again, it's throwing warm bodies at it. It's the particular process we use to do it. And, you know, where it goes to investigators and it goes to the legal division. And then if it's a dismissal, it has to go to Patrick and he and I have to agree to the dismissal. All of those things are what we have done to lower those times. But
and are we operating at full staff in those positions?
No, we've got four staff attorneys right now. We had 5 originally. I'm not planning on replacing that fifth unless it's absolutely needed. Part of what we had to do, in the previous biennium was we sort of used, as positions went vacant, if we felt like the staff we had were holding the line and still making progress on chewing down everything, then we would cannibalize that position's salary to upgrade the staffs that were still with us. That's needed in order to achieve staff retention. So, I mean, it's all this stuff you pull on the thread over here and it wiggles something in the tapestry over here. So, I know people will think, well, okay, so that means you got an extra staff attorney. No, I've actually already allocated that money to our existing staff attorneys so that we make sure we don't lose them. Because if we lose them, you're going to see that those numbers degrade even further, and that's what I want to avoid. One of the biggest ways you can hurt your number is by not taking care of your people and having high turnover, and then you spend all your time looking for new folks and training them, only to have them go out the back door again. So that's what I want to try to avoid.
Thank you very much for answering that question so that the public could also hear.
Yes, ma'am. As far as the budget numbers, we've given you that. I haven't given you the first month's the September budget for September because there's just nothing on it. But I gave you the last month of fiscal year 23, the August month. I mean, it just shows you the budget, everything zeroed out like it was supposed to. No issues there. I've included something new in your materials under, as far as 3C, the update on licensing functions. Mr. Spear does a really good job. This is something we've been doing for a while, that monthly licensing master list. If you guys ever want to know kind of where we're going month to month as far as licensing numbers, he does a really good job and has a really handy dandy chart that you can see at a quick glance. Are we gaining in licensee population? Are we losing? Where are the gains and losses at? I may start including that in our meeting materials unless y'all just say, I only want it, upon request. But I always personally think it's handy because it helps you identify trends. We can tell if some month we have a drop off, we can try to figure out, okay, well, what caused that? Oh, well, it's Christmas or it's Thanksgiving, whatever. So anyway, it's just another piece of information that's at your disposal there. We've been using it for quite a while, but I never really shared it with y'all until now. So if you don't like it, you can let me know.
I do like it.
Okay.
Yeah. As long as that's not creating additional workload, I think it's useful to see the numbers and how they, where are our licensees and like in terms of what professions, and then also this would be additional work, which I think something to look at from time to time is look over like year over year, like historical trends of, I guess that's.
Tim does that too in that chart.
Yeah, I guess, never mind. So sorry, I didn't look at that.
I will tell you there's two areas of, I guess you would say, attrition where we're seeing things, and that is in the LPA and the LBSW. Those are the two areas where we seem to be losing licensee populations. Everywhere, or losing population. All the other areas of licensure, we're gaining population. Roughly if you look at the numbers, we're basically gaining 3,000 to 4,000 or an MFT program every year is really what we're gaining. Is kind of an easy way to look at it. So just, if anybody's wondering out there in the public, what are we gaining? It's about 3,000 to 4,000 licensees every year is what we gain. So, okay, with that, the next is the agreed orders, the next is the monthly report from enforcement. Of course, we've got the agreed orders in there. Alfonso does the end of year enforcement charts for you. Those are just pie charts, visual depictions of the numbers. The court, the enforcement status report, that'll tell you kind of how many pending complaints we've got. We've got 407 pending complaints, which is kind of right in line with what we've had over the past year. It was in the upper 300s, but it's 407 right now. New complaints, we got 151. Again, that's pretty on par with what we got in the third quarter of fiscal year 23. And you can see the breakdown. There's nothing unusual in the breakdown. Everything is rocking along. I know one of the things that Patrick and Alfonso are going to talk about again is kind of how do we get rid of those older complaints in like 20 and 21, fiscal years 20 and 21, so that we can get rid of them. There's not many pending in those years, but you can all but be assured that those are probably more difficult complaints that are still pending there. Otherwise, they wouldn't be there. Let's see, the compliance report. Let's see here. Yeah, the compliance report, of course, Mr. Fernandez has given that to you as well. I'm not going to put that up on the screen because it's got email addresses and what have you on it, but it's there for your review. Enforcement's handling that. Everything's on track. If anything gets out of line, we take it to one of the member boards to determine how they want to handle the non-compliance. Agreed orders and dismissals for the fiscal quarter. Those are all in your materials there. I'm not going to go over those unless there's any questions. SIPAC, Patrick, I don't know if you've got an update on that.
There's a meeting, full commission meeting in November, on November 16th, 17th, and it's up to about 40 states now, so. that's
Okay.
about it.
Also, just so that everybody's aware, Mr. Hyde, are you on the executive committee now?
Well, yeah, I'm on
You're
the
on it?
executive
Are
board
you-
right now.
You're
Yeah.
running for the chair?
Well, I'm running for that, but I'm already on the executive committee.
Are you opposed?
I don't know yet, I don't think
Okay.
so.
So Mr. Hyde is throwing his name into the ring or in the hat for the chairmanship of the executive committee for SIPAC. So it's a pretty important position, as you can imagine. So I'm grateful for everything he does because that's a lot of work, serving in that capacity. It's one thing to just serve on SIPAC, be a commissioner, but it's another thing to actually serve on the committee like he does. So I'm pretty grateful for that.
Congratulations, Patrick. Hope you do get it.
Thanks. I don't know if I will kick myself later because I'm already on the rules committee and the executive board, so like, why did I decide to do another thing? I'm not sure, but maybe I'm
deserve
sure it'll
it. I
work
think-
out.
You can kick yourself then. It's okay.
Yeah. after the fact.
I don't have anything on the standardization committee. They haven't met in a while. We just haven't really had anything to take to them as of lately or any pressing matters, but just know they're still around, alive and kicking. The next one is Ms. Stubblefield. If you'll remember, Janie Stubblefield was she was our designee to serve on the Children's Mental Health Strategic Plan Subcommittee over at HHSC.
There,
Yes,
while
sir.
you're adding her, can I make a motion that we excuse the absences of Chair Conseco, Dr. Scoman, and Ms. Rogers?
You've heard the motion? There's second?
Sorry, everybody, just a little bit of housekeeping.
Yeah,
Um,
without objection, that is approved.
Good.
Thank you, Chair.
All right, Ms. Stubblefield, the floor is yours, ma'am.
Good morning, council members. My name is Janie Stubblefield. I am a licensed professional counselor and board approved supervisor, and I'm honored to serve as the council's representative for the Children's Mental Health Strategic Plan Subcommittee. The subcommittee has started meeting. We have actually met 3 times, and the plan is to continue meeting monthly. We've finalized the vision, mission, and guiding principles at yesterday's meeting. The Texas A&M University is doing a one-time analysis on the number and types of resources that are currently available in the state of Texas for children. And from that, we're going to be looking at some key data components that are going to include identifying the mental health services across the continuum of care, developing a roadmap to improve children's mental health care, and then defining measurable strategies and collaborative opportunities, ultimately that will go into the report that will go to the governor's office at the end of next year. And so that is what this committee is working on, and I'm grateful for the opportunity to serve and bring back news as it comes. So are there any questions?
Ms. Stubblefield, did they have any estimate on how long that study at A&M would take?
So they received some grant or money from the governor's office, and they have 2 years, but it's broken down into what they're expecting to complete the first year and what they're expecting to complete the second year. And I can give you some specific outcome measures that we're looking for from those reports from Texas A&M, if you would like that.
I was just wondering, I was just wondering if they were gonna have their study done by the time y'all's report is due.
So their year one study, I just pulled up my notes here, is from September 2023 through August 2024. And we're pulling some of that data from them. And then their year two study is the following year for 2025. But we're hoping to have, it's kind of a simultaneous collaboration with Texas A&M. They also are participating in the subcommittee.
Okay, good deal. Y'all met a lot if you've already met 3 times.
Yes, sir.
And he's trying to write a dissertation right now.
Oh, okay. All right. If there
Thanks,
are any
Jamie.
other questions, that's it. Thanks, Ms.
Thank you.
Stubblefield. We appreciate it. Thank you for representing us. The next item, Mr. Chair, is just the report from SORM. We underwent a risk management program review. These are typical. We undergo them every 3 to 4 years typically, where they just come in and try to identify. It's not actually a true audit. It's just a review, and they try to identify certain areas. I put the findings in there as well as our response to those findings. Most of the recommendations were about purchasing certain types of insurance, which the only one that I did go ahead and greenlight the purchase on was the contents, building contents. If this building burns down, TFC owns it. They don't insure our contents, so our cubicles and all of that stuff, or not cubicles, but our laptops and all that stuff. Just whatever it would cost to replace that is what we're covered for. The others, I did not opt. Cybersecurity insurance is way too expensive for what you get.
Right.
And it doesn't really protect you against accidentally clicking on a link. So I'm like, I'm not gonna pay that kind of money for no coverage. And then the D&O insurance, I'd looked into that a while back, but it simply does not provide the coverage. And I tried to talk to the underwriters, their counsel about it. I never could get a clear answer whether it would cover what my concerns were for directors and officers. And so I just opted not to purchase it. I'm not gonna buy something I don't know for sure is gonna cover us. So I said no to those two, but we are purchasing the, for lack of a better term, renter's insurance is what it is. But other than that, that was it on SORM. And then, of course, there's an article just for your review in there. I try to keep y'all apprised anytime I stumble across studies or articles like that. I've also got in here the letters from Senator Blanco and from Representative Cook regarding online continuing education management programs. If you'll recall, at our last council meeting, you guys authorized me to put together an RFP, a request for proposal, to solicit bids for online continuing education management programs. So we're still working on that. Candidly, the reason it's taken so long is that is a more complicated process than I thought, and I had never done one. So I'm piggybacking off the medical boards. I'm using theirs, and because they did the exact same thing, they took the exact same course of action that the council did at its meeting. They said, well, even though it's a no-cost option with CE Broker, we're going to put out a bid for it to see who else is out there. So for whatever it's worth, it looks like y'all made the right call whenever y'all did that, because another independent board did the exact same thing. So, but we're still in the process of that. We haven't dropped the ball on it or forgot about it. And then the last thing is the report on one of our boards. The LPC board had inquired about having DPS security at its meetings. And so we've been looking at doing that. So if any of the boards or the council for that matter, if you're interested in having a DPS trooper at your meeting for security here in the Bush building, it's a pretty simple process for y'all. The chair just needs to ask us, and Ms. Skiff and I will then put those wheels into motion. I don't know what it costs, because the security that was provided for the LPC board meeting, because DPS is in the building, they just kind of rotated troopers up here. We basically had a squad of troopers up here for that meeting. I don't know what was going on, but we had a squad of troopers up here. So we've got pretty good response time here in the Bush building is what I'm saying. Now, if you have meetings outside of Austin, that's going to throw a wrinkle in how we would get you security at wherever it is. Like the MFT board has meetings a lot of times in different cities. I'm not sure how to handle that. We'd have to look at that if you wanted security at another location, but if any of the boards want it here in the Bush Building, just get a hold of Brenda or myself and we can start that. We can get that in the works for you.
Council, I requested this of Daryl, and Daryl, I appreciate you looking into it. Just as an aside, LPC board is looking at getting back together, meeting in person, and therefore just wanted to make sure here at the new building that we kind of had an unobtrusive security presence, just in the interest of safety. I mean, I go into the courthouse and I have to go through more security than going here. So just wanted to make sure that something that that's cost effective, that's not going to bust any of our budgets, will do what's necessary, but also just not really change the overall tone of having an open public meeting. And Daryl understood that and he went with it. So that's really where that's coming from. I appreciate it. Thank you.
Yeah, you bet. Going back up to 3I, I forgot that we also recently underwent an SAO audit. The report from that audit is not public yet, but I've shared with you all the confidential draft of it. It's in there in your materials. We can't disclose that in public, but I've also given you the agency response or the management response to that. So we're working with the SA on that. You're going to see one rule in particular later on that's a direct product of that SAO audit, and I'll point that out when we get to it. But that's all I have on agenda topic number 3. Are there any questions on any of that?
I'll just say, I appreciate you adding that article, a high cost of mental health, of licensing mental health occupations. It spoke mainly to social work. I guess it didn't really talk a whole lot about psychologists, but this plays into something we're going to talk about later, about cost and making sure that we're not adding cost to licensure barriers to entry. So I really appreciate that that's included. It's interesting to me to see the context. Again, being chair of the psychology board, that's where I'm focused, but to see kind of these same challenges in terms of licensing cost of what does it cost to mint a new mental health practitioner, that psychology is not exclusively dealing with that problem as well. It's across the board. So thank you for including that.
Yes, sir.
Any other comments, questions? All right, hearing none, we're going to move on to action items. We're going to start with 4A. This is with Ms. Sonia Gentry, I believe.
Yes, sir.
Not Dr.
She's the applicant.
Yes. We basically, our hands are pretty tied here, guys. I'll let you guys talk about this to the extent that you want to brief us.
This is an application denial. A social worker had applied with us. Unfortunately, Ms. Gentry had a disqualifying criminal history event. And the reason it's disqualifying is because of Chapter 108 of the Occupations Code. It really ties our hands. Candidly, I feel like there would be I'm pretty confident there would be a different outcome on the decision of whether or not to license Ms. Gentry, but for Chapter 108 of the Occupations Code. I know that's no solace to Ms. Gentry, but I do want the public to understand that, and Ms. Gentry to some degree also, that this decision was not so much ours or in the social work boards of its own making, but rather what it was required or mandated to do by statute. So whatever comfort that is, there it is now. Ms. Gentry, if you are in the, if you're an attendee in the audience, you are more than welcome. You've got an opportunity to comment to the council here this morning. If you're there, if you raise your hand, or if your attorney, if you have an attorney is there. I'm not seeing any hands come up, so I'm assuming that Ms. Gentry, you're not here.
If Ms. Gentry is here for some reason, when we get to public comment at the end, I'd be happy to
We can revisit.
revisit hearing from her. I'm not sure. Again, I think our hands are, it's pretty clear with the statute that of what we must do here.
Yeah.
And it's worth mentioning in the materials, this went to SOA, a proposal for decision was issued. It also said we have to follow 108, we have to deny it. It went to the social work board to look at the proposal for decision. And they also agreed there's a proposed order for ratification that the social work board voted and approved, and that's been sent to the council for ratification that would deny the application based on 108.
So we would need, I'm looking here on my screen of the final decision in order to deny it. We would need a motion to approve that to be signed.
Correct.
Ms. Smith,
Thank you, Chair. I also want to make sure that any public member that is out there that's hearing this, because I'm not sure if we say this often enough. Our governing bodies, all of our boards plus BHEC, the statutes can only be changed through legislation. We don't make those rules. And so it's not sometimes when Director Spink says our hands are tied, they are tied. So hopefully this could be addressed at the next legislative session, but I just want the public to understand when they hear the word statute versus rules, we have some purview over rules. We don't over statute. Those changes have to be approved by the legislative body. I just wanted to make that point. I appreciate you letting me do so.
that's a great point, Ms. Smith. And the other thing too, that if I can just append one thing to that, is that as the board, we don't argue for or advocate for or against legislation. That's the legislature's prerogative. Obviously, we have opinions in our personal capacity for many different issues, but as the board, we do not get involved in lawmaking. Dr. Taylor.
Yes, thank you. I want to agree with Ms. Smith as well. I think it's a great point. I also want to state that I know that the rules can be a little challenging. They can be confusing. They're written by lawyers, so thank you, lawyers. So they're not easy to read. Also, if you're a member of the public and you're considering going into the profession, I highly doubt that you would ever think to go and read the rules or look at the statutes. It is our responsibility to know them and define them. I would like to encourage, while it's definitely not the responsibility of the education systems or the professors here, but I would like to encourage you all in your intake classes, please make this requirement known if it is a requirement for that board. I think one of the most tragic things for Ms. Gentry is that she went through this entire educational process. She earned everything she needed to earn and then found out that there was a law that said that she couldn't do what she wanted to do. And I think that's just sad. So I just wanted to make that known as well. So thank you.
And Daryl, if I may, right quick, this is Social Work Board, Brumley. The BHEC has a process, so anyone can, at the beginning of their educational process, request a criminal history background check that will allow you to know at that point in time, the day that it's done, not moving forward, but from that point backwards, whether or not you can meet the qualifications required to sit for the exam or the license under that board. So there is a process that is available to everyone on the front end if they choose to make effort to do that.
That's correct.
Any other comments, questions? Hearing none, I'll entertain motions.
I'll go ahead and make the motion to follow 108 and deny the application.
All right, it's been moved. Is there a second?
On a second.
It's been seconded. Any further discussion? Hearing none, all those in favor of the motion to deny signify by saying aye.
Aye.
Opposed, say no. The ayes have it. I appreciate the discussion there. Ms. Gentry, I think you heard that Ms. Gentry is here. You can come back and see this. I think it's clear that this is if we had discretion, it may have been a different outcome here. So, thank you. Okay, moving on. Daryl, we're going to talk about the risk management program review report.
Well, the next item under 4B is approving a revision to the personnel manual. I know this is y'all's favorite thing to do is review our personnel manual and approve updates to it, but this change was brought about by the SORM review. They needed us to add some return to work language in there, and I made some other cleanup and I highlighted all that for you. So I just need an approval of those revisions.
Is there a motion to approve? So moved. Is there a second? Second. All those in favor signify by saying aye.
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 The ayes have it.
Okay, the next item is one, I would like to inquire whether the council would be willing to change its October 22nd, 2024 meeting date to either the 15th or the 29th. My preference would be the 15th, but either one will work. So that I can attend the governor's executive development program. If you don't want to, that's fine. I'm not gonna miss a council meeting for some type of, for a training session, but none of the other council meetings conflict. It's only this one.
Fine
I
by
think
me.
Go ahead. Gene.
Yeah, I like the 15th as well. That's
15th.
Same.
Can you just do a motion? real
Sure.
quick?
Is there do I hear a motion for the 15th?
So moved.
So moved. Second, without objection, the 15th. And just for everyone's edification, if I ever say something without objection and you want to vote on it, just say I object and we'll take a vote on it. But for these, I'm just gonna proceed without objection.
The next item is gonna be 4D. It's just this was something that Chair Canseco had requested staff put together at our last council meeting. So we did, it's there in your meeting materials. I think probably, I don't know what to do with it now, but we put it together and it's there for your review.
Very good.
And no action is needed on it.
Very good.
Anything you want to highlight, we're particularly proud of?
Well, yeah, I mean, we have chewed down all those backlogs and I feel like people seem to be, I feel like people are appreciative of kind of where we came from and where we are now in terms of processing times, customer service levels, those types of things. So I recognize there's room for improvement. Don't get me wrong, public. But I think we've come a long way. I'm pretty proud of that. I'm pretty proud of my folks for doing all that.
I'll say this is that what I recall is seeing letters from legislators, phone calls from legislative staff, public comment. And if you look at what we've seen lately, there's a whole lot less of that
Yes.
than I've historically seen. So I think it's clear with government work like this, there's not a whole lot of people around to say attaboy when you're doing it right. But when you're doing it wrong,
Yeah.
we'll hear about it.
There's plenty of.
Plenty to go around.
But Daryl, I've noticed that criticisms or requests to change something, they're typically couched in terms of, it's so much better than it used to be. However, how about changing this one other thing? So that's testament to the improvement.
Okay, good.
That, and I guess that also is a great ethos, is that we are always improving.
Yeah.
And we are not done, but yeah.
I can assure you that your staff are not wired to rest on their laurels. Most of us are wired to keep pushing and pushing until y'all say, won't you just chill out and give us a break? So that's probably our biggest downfall, is we may have a tendency to outrun our supply lines sometimes.
Well, we appreciate that. Next is review and approve the 2023 Texas Behavioral Health Executive Council Customer Service Survey. And so we need, if there's any discussion on the survey of what's the contents or what it needs to say, this would be the time. Otherwise, you just need a motion from us to approve it, to send it.
Correct, yes, sir.
Okay, is there any discussion, questions?
It's the exact same survey we used last year,
Okay,
last biennium.
to approve.
then move to approve.
Yep.
Your
Second.
second, then seconded, without objection. Send it.
Okay.
Thank you.
What kind of response percentage are we getting on that?
I want to say we got around 9,000 or 10,000 people that responded to it last
Okay.
time. It was a very good response. I will say this, I get to brag a little bit on our licensees here, because I don't think most agencies get the kind of response we get. Y'all actually, I'm talking to the public, y'all actually respond whenever we put out surveys, and I cannot tell you how grateful I am for that. What is incredibly aggravating at this level at a state agency is when you ask for help or assistance or information and it's just crickets. And then we're kind of left flying blind up here as to what you guys think or want or need. And so y'all have done exceptionally well at responding to that workforce survey. And y'all have historically done exceptionally well at responding to our customer service survey. So the only thing I can say there is keep that up, please, because that is critical to us being able to do like strategic planning. I mean, this customer service thing is going to be critical in strategic planning, which is what I have to do it in connection with. So please, whatever y'all do, don't ever tire of responding to surveys that we send you. We'll try to be mindful and not make them long.
Amen. All right, moving on to rulemaking for BHEC. Section 5, review and consideration of the following proposed rule changes. We have 5 that we're proposing and 1 minor one that we are considering adopting. Daryl, I will hand this back to you.
Okay, I'm going to kind of give a quick high-level overview of all of them, and then if there are any questions. So 882.23, the license required to practice. This is these are the changes. If you'll recall at our last meeting, we talked about what rule changes would need to be made for a license for an individual who is in Texas to deliver services to his or her patients or clients in another state. In other words, it's not one of our licensees, but they've got to treat somebody back home. They're just here to take care of mom or here on vacation. And these are the changes that we would need to implement in order so that we didn't catch that individual in our licensure net here. So that's the purpose of this.
And hang on, in practice, if a therapist is on vacation and wants to do a Zoom session with a client somewhere else in another state, in practice, this is probably already happening.
Oh, yes.
Yeah, so, yeah, and
This just takes it off of my table of having to police that individual
Correct.
for something that it's not harming anybody here.
correct.
And so it's functionally it's something that I think probably needs to happen. It's a little more difficult to write it. I know Dr. Taylor's like, boy, the lawyers got a hold of this one. But you know, hey, what can I say? It's job security, Dr. Taylor.
And hang on real quick, if you can explain this in a way, if we can propose these en masse, tell us
Yes.
what we are looking at here to where we can make that, if assuming there's no one wants to take anything out, after you're done explaining it, to where we can actually
Okay.
all clearly.
Okay. The only point on 882.23 that I wanted to highlight was that very last paragraph where it's labeled number 5, any related term. I just wanted to highlight that in case that gave anybody heartburn. It doesn't give Patrick and I any heartburn to include it in there. What we're trying to do here is capture all the different types of practice that mental health, clinical, forensic, counseling, I mean, you name it, because y'all have such a wide variety of practices or types of practices, we have to write that so that it captures all of that. That's why that rule is as long as it is. But in short, the function of this rule is to make sure that folks who are visiting here and treating individuals outside of Texas don't need to get a Texas license. It does not say that if you're treating a patient in Texas that you don't need a license. That is, if you're treating somebody here, you have to have a license to practice in Texas. But if you're treating somebody outside of Texas, you're not practicing in Texas. You're practicing wherever that patient is located. And we will not be the first state to adopt this viewpoint, I can assure you. There are many other jurisdictions that have it. So that's 882.23. 882.28 is the rule changes that are needed in order to implement putting a doctoral degree on the wall certificate. We discussed that at the last council meeting. It's something that came out of the LPC board. These are the rule changes we need in order to get that done. Pretty simple there. The renewal, 883.1, that is a rule this is one that's a product of the SAO's report that you had in your materials. Under statute 507.258, we're supposed to review NPDB background checks on every licensee who's renewing a license. Practically speaking, we cannot do that. I would have to use every staff member. I mean, all 50 something, 58, 59 of us to do that. And I probably still couldn't keep up. So, but this is a problem that the SAO noticed in their audit. So the compromise that I came up with was Okay, we'll make those individuals who are under CE audit produce a self-query report and we'll look at that. And you know, that hopefully that kind of meets in the middle there. It's a compromise. So that's what this rule change does. We are not going to make the entire licensee population do a self-query report every renewal cycle. But if you are selected for CE audit, you will have to produce an NPD self-query report. That's it. That's all you got to do and send that into us. It's not that burdensome.
Daryl, can you explain that self-query report, just like what that?
Yes,
that does.
the National Practitioner Data Bank is a centralized reporting location for all administrative and some legal actions taken against medical, mental health, just healthcare providers in general. And it's supposed to be a common source. And so what we do, if you were an applicant coming in, we would say, you have to give us a self-query report from the NPDB. That report will tell us, hey, has Daryl been in trouble in any other state? Has he ever been sanctioned for anything else? And then that way we know it whenever you're coming into our licensee pool, and we can take whatever precautions we think appropriate based upon out-of-state disciplinary action. Well, we have a rule that says you have to report any disciplinary action in another state once you're a licensee. But there's, you know, if somebody doesn't report it, there's no way to know that they actually got sanctioned. Whereas if we make them give us a self-query report, we're going to see that on the self-query report. And then we're going to be able to take disciplinary action on our own in accordance with whatever the violation is. So that's the purpose and function, is to make sure people are not telling us that they got in trouble in another jurisdiction and therefore evading disciplinary action here, is the purpose behind it. It's just, eventually I would like to get us on a continuous query, which is kind of like what Ratback is for fingerprints. It's just a continuous running NPDB report. And if you get in trouble elsewhere, they would then send us notification immediately. The problem is that's about $200,000 to $250,000 a year for all of our licensees. We don't have that kind of money. I'm going to have to go to the ledge and ask for that kind of money. So absent that, I think this is our best option, is making folks under CE audit submit it as a condition of renewal. So that's the purpose of this rule. And then 884.1, we're making an exception to the rule of limitations, in that if you have a complaint pending against your license, but your license expires before we're able to resolve or dispose of that complaint, what we do is we put a little marker on your license so that if you ever try to reinstate it, we would know, hey, he had a complaint, and we would reopen that complaint against you so that you couldn't evade it. Now, the problem with that is I don't ever want to encounter the situation where that happens, but say you've been out 10 years and now limitations is run, we try to reopen it and they assert a limitations defense and say, well, you can't do it now. It's time barred. So I'm removing that. This rule change would remove that defense. They wouldn't be able to say, well, I waited long enough to where you can't reopen the complaint. No, we will always be able to reopen it if it was pending at the time your license expired. That's that rule change.
I have a question about that
Yes, sir.
legally. What if somebody has a complaint filed against them while they're subject to we can regulate them, we can sanction them because they're licensed by us.
Right.
At the time that the infraction and at the time the complaint was filed, why can't we go after that? If they just wait for it to expire, why can't we still sanction it under the auspices or whatever of when they were licensed? We're sanctioning it under that. Is there a legal reason why?
You're talking about after the license has expired?
Yeah, just because it expired, but we're
Yeah.
sanctioning the license as it was when it was the infraction or the wrong was created, what happened.
The way we've always viewed this is more akin to criminal law, in that, like, the only authority we have over, say, Chair Brumley or Ms. Smith is by virtue of that piece of paper they have. Unlike criminal law, where a deputy can go out and lay hands on you, excuse me, and they can control your physical person, we don't. We don't have any authority. So the way we've always viewed it is, as long as that license is active or it's in a renewable state, we have jurisdiction to do something to it. But once it has expired, it has died. And it's kind of like in criminal law that once a person is dead or been deceased, you can't convict a corpse. it's the same thing here. We can't do anything to a dead license.
Yeah.
And so that's how we've always viewed it. And we don't have, we don't have like, money judgment authority, we don't have authority over your body. It's just that license. That's the only thing that gives us any power over an individual whatsoever. Once it goes away, we lose that power. But then once they reinstate it, you've now subjected, it's been revived and we can then take action against
Right.
it again. So that's how we viewed that. Not every state views it that way. I mean, not every agency in other states view it that way. I will tell you that. There is kind of a hodgepodge mixture, but to me, I've always really struggled with, well, what are we gonna do with, because I'm thinking about you can't revoke an expired license.
Right.
I mean, you can't reprimand it. You sure can't suspend it. What are you gonna do to it? From a very practical standpoint, I don't know what you're doing to it. So,
That's fair. But when you tag it this way, that it runs,
right,
you can always.
right. You can always bring it back up. Yeah.
Great.
Yeah. So anyway, that's the purpose of this rule change. And then 885.1 is just a corresponding fee change to go along with the 882.28 rule change above, Roman numeral 2 above. It's adding the $54 fee for if you want to add the doctoral degree to your Walser.
So in order to move these, we would move to approve them as presented.
Yes, sir.
Okay, is there any discussion, or does anybody have questions or need to pull any of these out to take them individually? Hearing none,
I'll move to adopt.
been moved to adopt, or, I'm sorry, it's been moved
Propose,
to propose as presented. There's second. And seconded by Mr. Brumley, I believe, and any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All opposed say no. The ayes have it. Thank you very much.
Okay.
Moving on.
Next item is being 882.32, which is being considered for adoption. This is a change that's needed to comply with Senate Bill 510. There was one comment submitted in connection with this rule, but I think it was mistakenly submitted. The comment actually pertains to a psychology board rule that is not before the council today.
Very good. Any questions? Any motions?
I make a motion
To approve?
to approve.
Okay, the action, sorry, to propose.
No, this
No,
is
sorry, to adopt, I'm sorry. It's been moved to adopt
I'll
by
second.
Ms. Smith. It's been
I
seconded.
second.
All those in favor signify by saying aye.
Aye.
No, opposed, say no. The ayes have it. Thank you very much. All right, moving on, we have no rules under marriage and family therapists. We have no rules under psychologists. We have one proposed rule change coming from the counseling board.
Yeah, I'll
I'll
take
turn
this.
that over.
Council, this is pretty straightforward. At the LPC board meeting a week ago, last Friday, we approved a proposed rule that would eliminate the 5-year deadline to complete your licensing after passing your exam. We just took it out. This brings us in line along with what psychology does and what MFT does. Yeah, it's pretty straightforward. But if you have any questions about it, please let me know or Dr. Taylor know, but
Very good.
it's not very controversial and it's kind of bringing us in line with what the other mental health boards are doing.
Very good. Thank you, Chair Halbauer. Any other questions? Any motions?
I move we approve the proposal.
Second.
Been seconded. All those in favor signify by saying aye.
Aye.
Opposed, say no. The ayes have it. Thank you very much.
Thanks, everybody.
All right, we're moving right along. Social workers have 2 proposed rule changes. Patrick, are you taking this for us?
I
Mr. Hyde,
can, yes,
away.
781.323 is a proposed change, and it essentially mirrors what is in the MFT rules regarding supervision or providing services to clients outside of a state. And so it's just some clarifying language and some additional helpful language to also emphasize that the same standards of practice apply for face-to-face services if you're doing it via technology or electronic practice. And 781.412 is a similar change to what the LPC board is proposing. It does away with the 2-year shelf life for the examination. Once you've passed the examination, we can count that examination, and it's not going to expire after 2 years. The passing score won't expire after 2 years. And that's pretty much it for those rule changes.
All right. Any questions, discussion? Hearing none, and are there any motions?
I'll make a motion to adopt the proposals as stated.
I'll second.
It's been moved and seconded to adopt the proposals as stated. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed, say no. The ayes have it. Thank you very much. Moving on.
Chair
Yes.
Belinowitz, before you move on, I have
Yes,
a
sir.
question for Daryl or Patrick. Will y'all update me? I'm lost as to where we are on the rule that we talked about as far as CEs for field instructors.
It's been adopted.
So
isn't
it's
it?
going
No,
into the
Has it not been
registry.
adopted?
It's already, it's out for public comment right
Oh,
now.
okay, I'm sorry.
Okay,
It's- I
okay,
think it just closed, I think public comment period just closed yesterday on it. So it should come back to the next social
That's
report
right.
meeting.
You're right. I'm sorry. I missed.
Okay.
That's right.
all right.
Yeah.
Because we
That's fine.
proposed it at the meeting. You weren't
Yes.
there, and yeah, Patrick and I
Yeah.
handled the proposal of it. So that's right. Yeah, it's out for public comment.
Okay. Thank
Good
you.
deal. Thank you, Mr. Brumley. Okay, moving on, report from member boards regarding current and future issues that may impact professions or agencies' regulatory functions. I have some stuff to talk about here from psychology, but I'll defer to the other boards first. Anybody want to go first?
I'm happy to go first, Chair. We don't have
Let's go.
very much for MFT. We have been going around the state of Texas, meeting in different locations where we have school programs to kind of allow the students to meet with us, talk with them about their concerns. It's been very well attended. We just got through meeting down in Abilene. We will have our next meeting in January. Excuse me, Friday the 26th, we'll be meeting in Austin and going over and saying hello to over at the program at St. Ed's. We also are going to have 1 hour of CEU on Friday, October 27th, a lunch and learn for people that wanted to know what's happening as far as our ability to cross state lines or get in a compact or things like that. Kind of just to update our licensees on that. Like I said, that'll be Friday, October 27th. And we are looking at, in our packet of CEUs, not in addition, but a spell out of 1 hour for crisis intervention, which would include any kind of crisis, whether it is individual for suicide or mass tragedy, that would be a CEU for us. So that's what we're looking at. We just want to make sure that we are allowing our licensees out of the 30 hours that they need to have, they have enough they can pick and choose without being overburdened by the requirements that we already have for them. And that's about it.
Very good. Thank you very much.
Yeah, okay.
Hanson, go ahead.
LPC board members are currently getting out and interacting with members of our licensure. And we last Thursday, I joined Executive Director Daryl and our board administrator Christina DeLuna at the inaugural meeting of the Association for Mental Health Professionals, a new stakeholder organization. So Daryl, thank you for joining us at that meeting. And next week, we're going to have a panel presentation at the TCA conference in Houston. Vice Chair Taylor will be part of our panel presentation. Dr. Bradley, Vanessa Hall, one of our public members, will be joining me on that panel next week at TCA. So for the public to hear, I say it a million times, we are always grateful for the opportunity to get up there, meet people directly and hear from you. Our other big thing is we are really starting to put everything in line for our upcoming 4-year rules review. It's going to be led by Dr. Taylor and myself. It's not going to be the most fun thing that we're going to do next year, but it's very important. We made a lot of rule change, I guess, a lot of rule changes over the past year and a half, and we kind of put the brakes on the pace that we were making those changes because we are putting everything in line to examine it during our upcoming 4-year review. And that is going to be super fun, right, Chris?
Super convincing.
Dr. Taylor, anything to add to that?
He's speechless.
Where are we doing this?
Yeah, man, I can't wait. I'm so excited.
Anything else that you want to add?
No, I think that sums it up, Mr. Chair. Thank you.
All right,
Very good.
appreciate it.
Mr. Brownlee, do you have anything from social work for us?
Yeah, I will update y'all. Sarah, the board manager, and I attended the NASW conference, I guess last week, 2 weeks ago in Galveston. We had a very good turnout from the public there and were able to answer lots of questions and interact. The only concern that was presented to us, and we talked about it last year with Daryl a little bit, and he explained it, and we used his explanation in detail. It was about the cost of the criminal history review thing that they do, where it had been $50 and now it's gone to $150. We had 4 or 5 schools, school personnel came by and talked to us about that. We explained in detail the process that has to be done by the attorneys to go through each of those counts to see where they fall in line with the rules and the statutes that we have to follow. So I haven't had any feedback from any of those folks that we answered that question to, but that's just something that's out there on the radar for y'all's boards as well. We will attend next week the Association of Social Work Boards Conference and have updates and information about the exam process that's undergoing some change and review. So that's really all I have.
Very good.
Quick one.
Go ahead.
Did the fee adjustments go into effect on September 1st?
Yes,
That cleared all the hurdles?
cleared all the hurdles.
Okay, so that is, all those are now in place.
Yes,
So I apologize, I meant to ask you that earlier, but
yes.
let's get it in here.
Yeah, in fact, you can pull up the rule now, 885.1, and you can pull up graphic number 1, will show you what the fees were prior to September 1st of this year. And graphic number 2 will show you what they are now, and you can come compare those side by side and see there's some pretty significant reductions in there.
Yeah.
We cut over $1 million out of the fee generating.
That's
Well,
awesome.
Council, didn't we take that up at least a year and a half ago?
We did,
So-
we did that for a reason,
Yeah.
in case it drew any pushback from the powers that be that were counting on that money. That way they would have time to say, no, don't do that. You're gonna foul up the budget, and then we could claw it back before anybody came to rely on it. But nobody had any objections to it.
Yeah.
We were proactive in trying to make people aware that that was coming, so.
If the ledge had a little less money, we might have heard about it, but
Yes,
we're in good shape.
it's true. It was the right year to do that.
Yeah, it was.
It was the right biennium to do it in.
Yeah.
Yeah, so, hey, great job. I honestly, I was a little skeptical that it would ever.
I was worried too.
That it would reach this point, but you know, to our credit, it's $1 million back to licensees and
Right.
future licensees.
Right.
So good job.
Yeah, that's nothing to sneeze at.
No,
Yeah.
it's not. All right. Take it, John.
Okay, from psychology, Dr. Cartwright, I'm gonna ask you to chime in a second, from a practitioner perspective on our entrance test. I want to lay out just the lay of the land. I've had the benefit of being steeped in this, but for everyone who's not steeped in psychology and how this works, to get into the profession. Texas has an entrance test. It's the EPPP. We don't own that test. That is administered by ASPPB, which is national organization of boards, not of the profession. This is the entity made up of boards and board members that administers and owns this test. I don't even know off the top of my head, how long has EPPB been around? Long time.
Long time, decade.
Yeah, long time. And this is it's one of the last stops. You know, we have different things from internship hours to postdoc years to this test. Things have changed. About a year ago, we just had our annual meeting with ASPPB. The year prior, a year ago, I was there and they announced that they were adding another test. This test has been around, EPPP Part 2 has been around, but a year ago they announced that it would be mandatory. And if you don't adopt it, we would lose access to the EPPP Part 1. So, okay, that sounds like no big deal. Just go ahead and let's just adopt this second test. Well, the problem, there's a lot of problems with that. And I hate to overuse cliches, but the psychology board is truly between a rock and a hard place here. We're on one side being asked to adopt this additional test that costs hundreds of additional dollars. There's a lot of questions, and I'm not making a statement on what I think about this. I'm just saying that the arguments are from some people that it may disproportionately affect and discriminate against minorities or immigrant populations. That's a broad argument against occupational licensing in general, but there's a lot of questions from that school of thought about this EPPP Part 2 test. From a regulatory standpoint, when we're being asked to adopt new regulation, we have to ask ourselves the question of why. What problem are we solving here? And I can point to, and I've had extensive conversations with Daryl and staff. Have we had problems since we got rid of the oral exam? Do we have a flood of or any, not even just a flood? Do we have any appreciable, measurable difference in practitioners who are less qualified entering the field? We can't do that. So again, we're either, and the point is January of 2026. January of 2026 is the deadline that ASPPB has put on us to adopt EPPP 2. There have been few public statements. I put a letter to my fellow board members at our last board meeting to address this. And I've had some feedback from some other states that share our sentiments. I'm not going to throw and out them under the bus just yet. But I expect that there will be pushback from other states on this adoption. We're working on discussing this with ASPPB to see if somebody's going to blink. But the bottom line is that something's got to bend here or stuff's going to start breaking. Because by statute, we have to have a test. And if the entity that has our test is telling us to do something that we can't do, i.e. adopt this second test, I don't know where that leaves us. Staff, we've talked about making our own test, which is promptly shot down because we don't have the resources or ability to do that. And so it's a really uncomfortable position to be in, because if by law I have to have a test, we're just going to have a really stupid test that's not going to actually do anything so we can comport with the law, because we don't have the resources to do anything else. And the other thing I would like to lay out, and then Dr. Cartwright, I want you to speak to, from your perspective as somebody who's in the profession, what was it like leading up to this test? What do you think it does? As chair of the psychology board here, what I'm trying to say is there's an iceberg ahead, and if we don't move and change course, we're going to hit it, except our rudder only kind of goes one way right now. So we've got to have a course correction. We're trying to get ASPPB's attention and to believe us on this. This is not, I just have it out for regulation and I just want to, this is coming from all different places, from the profession and the regulatory environment, of questions that are being raised. And there's just a real immovability right now from ASPPB's perspective. And again, something's got to bend or something's going to start breaking. So Dr. Cartwright, though, I would love to hear from you just and share with the board any other thoughts you have personally on it. And secondly, really from a professional point of view, how important is this test? What was your experience with it? And what do you think it does for the profession as a final check?
Yeah, well, thank you for the overview of everything, John. Appreciate it. Appreciate the letter that you sent. I mean, this has been a big debate, as you can see, and it's definitely something that's kind of heating up over in the psych board area. You know, I mean, we have till January 2026. That's what the quote unquote deadline is. In terms of, were you asking what the EPPP1 was supposed to do, or what the EPPP2 is?
I'm
intended
asking
to do?
the importance of the EPPP1 in terms of what's at stake here is if we're going to lose, if they're threatening to take away EPPP1, EPPP as we use it, like that's the thing is like, well, we can't lose EPPP1, so we got to adopt this, but we can't adopt EPPP2. So like, I think it's important for the public and for the board here to know from your perspective as a psychologist, the importance of the entrance exam, of not losing it, and that we have to find a, like, why is it so important that we have to find another solution? Why is EPPP1 worth fighting for, I guess is the question.
Well, I mean, the EPPP1 is, it's a national standard examination that ensures that all areas of competency are covered, from ethics to understanding statistical analysis, research, counseling, all the clinical elements, all the legal elements, everything that kind of are the basic tenets of what you need to know from a foundational standpoint as a psychologist. So it's what gives, it ensures that you have all the bases covered. There are always questions about, again, like face validity of questions, and if there's some discrimination built into some of the way some of the questions are worded. That's always been an ongoing thing that the ASPPB and you know, as a whole, the profession wants to make sure that that's not happening and try to ensure that that's not happening. But that is the basic tenet of the EPPP. It gives us a national baseline stance across the nation, so that from state to state, we can all say that we've met that criteria and are competent to perform and meet the satisfactory requirements and standards of the profession. That's what the EPPP1 is intended to do and does do at this point. Now, again, we used to have the oral examination, which was more of a, it was there to give more of a practical, ethical, pressure scenario where, you know, are you able to deal with these ethical dilemmas that come up? And that was what the oral examination was set to do. And again, I'm missing pieces of it, of what the full intention is, but that was what that was supposed to do. And obviously we haven't had it for, what has it been, about 5 years now. There has been no oral examination. So I think the kicker here is that, you know, really, like, what has changed? Has the profession weakened or lessened since the oral examination was removed? And, you know, most would say, I mean, there's not a lot of evidence to say that it has. So, you know, what does the EPPP2, what is it doing to sort of, I guess, improve? Is it necessary? And is it a burden? And maybe burden, not the right word, but again, yeah, there is a financial cost to it. It fairly expensive. Again, there's questions about the items, if there is a discriminatory basis to any of those.
And I might add on that note, real quick, Dr. Cartwright, I think that's a question that Dr. Lambden, who went to an annual meeting, this has been a thing. We don't have the data. They say it's not discriminatory, but we're asking to see the data. And to my knowledge, it's not being really shared. So I was,
yeah, I mean, I think they're trying to collect data on it, but again, it's, you know, who's interpreting the data, and is it ASPPB themselves that are interpreting the data, or is it psychology as a profession as a whole, with objective people coming in and looking at that data? So I think there's question marks about that. So again, just a lot of question marks out there. You know, is this an unnecessary roadblock? Many would debate yes, some would debate no, it's necessary. We have to have this competency-based exam. So, you know, this is a heated debate. It's going to continue to be a heated debate. I'll be curious to see how the next couple of years shake out in terms of, I like what Chair Belemowitz did, was ask for an open discussion with ASBB about, to answer some of the questions that as a whole, the professional psychology has, that the public would obviously have. So, to open discussions up, and it seems like there's just been it's been a little bit closed, where like just that we're not getting a lot of answers as to why, like what is the why in this, and what value would it add? And so those are questions are
And you point, what they're asking us to do is use the full force of the regulatory power of Texas to impose this new test. And Dr. Cartwright, to your point, there's still a lot of questions. And if you're asking us to enact that kind of regulation, like these questions have to be answered. So open it up to questions. I think you had a question.
And I was going to say too, I mean, one of the
Sorry.
keys here is also we do want to look to see what other states are doing too about this. And like, where is the consensus as a nation, from each state, what are they doing? What is the overall perception? What would be alternatives if not this? And what are other states? So I think that there's a lot of discussion there. And I know, I believe Executive Director, Mr. Spinks has reached out to other states to see what they're doing over there. States like Arizona, states like, we know California is a bit different in how they do things, but just trying to get feelers too of what the national consensus is and what's happening in other states, how they're handling it and what their perception on it is. And then maybe coming together and really being able to get the answers that we need, ask the questions to get the answers that we really feel we need as we move forward in these discussions.
And Dr. Cartwright, I'll tell you, I've actually had some discussions with some other states. Again, I'm gonna let them speak for themselves, but the questions that we have we're not the only ones. I'll just say that. So question?
How many states require this at this point?
The EWB2?
Yeah, in order.
I think,
6 or 7.
yeah, it's not many.
So 6 or 7 have chosen to do this and they want to make
And it's
the
like small
other-
states. It's
the
not,
other 43 are being forced to
Correct.
do it.
yeah.
Correct.
And most of those, I don't even know which 7, it's not large states,
No.
like California, New York, Florida have not, we have not.
Okay.
Some of the smaller states, and I'll just say this anecdotally. Just pick any smaller Midwestern state. They don't have the infrastructure that we do. And the way a lot of these boards are made up of, Texas is sort of different with a public member board like BHEC over it. So a lot of these boards are they're very dominated by the professions, and ASBB said it, and sure, they didn't. I still have, I think that based on our experience here in Texas with some of the legal fights that we've gotten ourselves into, with independent practice of master's level people, looking broader at the national legal picture with different cases, there's concerns.
Dr. Cartwright, I was kind of looking into this issue, and apparently there's a lot of debate on the effectiveness of EPPP Part 2. You, as the professional member here, what's your opinion on how effective this test is? Is this a true gauge of your ability to be a great psychologist?
I mean, honestly, I haven't taken the test. I haven't taken the EPPP Part 2, so I haven't seen all the questions, but it's supposed to be a competency based, ethical, have a lot of the ethics that are involved. So I don't know. I mean, is it going to change people that haven't been taking it that are qualified? I'd say in that case, probably not, but I'd have to really look at the questions and really read it thoroughly to know. But I mean, it's debated out there. Like some feel it's completely necessary, some feel it's not. I think the key is making sure that you have the base competency, and then especially in the supervision element, that you're getting the supervision you need and you're getting the training you needed in the field. And it really, what it's supposed to capture is that have you grasped that, and are you able to survive when you're in the lion's den, and there's these ethical dilemmas that are in front of you, and also that you meet the core competency levels of that. So again, debated. I'd have to really look at the test in depth and read look at the questions myself to make that a personal judgment on it. But it's out there. I mean, I think I don't know if I want to say it's 50-50 of people think it is and isn't, but it's definitely debated right now, and there's a lot of there's two sides to it essentially.
My other thought too is that if we have thousands of hours of supervised experience and internship and postdoc training, like we have all this other training. How is that not addressing the skills needed to do this? If you're able to pass the written test, you've got thousands of hours of somebody with hands-on with you doing it. Yeah, and in the real world, that's right.
And I think the key is, like, you look at what in the last 5 years since we haven't had the oral exam, has the profession gone, has like the quality of psychologists degraded? Has it? And I don't think that's happened. So, like, for me, it doesn't seem like this necessary element that we must add that's gonna change the profession, and necessarily, to me, it's kind of a neutral. Like, I don't really think it is a necessary positive, and I don't think it's a negative. I think it's great if you can pass the competency exam. It shows that you're able to do that, and you can show that and indicate that in an supposedly objectively scored examination. But the fact that we haven't seen like a lot of change since the oral exam was taken away, it goes back to how I feel like just the experience-based, field-based experience you're getting. If you can indicate that, show that, and prove that you have that, to me, that seems to be working. But I guess that's where it stands, and we'll see how things shake out here.
I have a comment on that, but hang on, Daryl, did you have something?
And I was gonna kind of piggyback off what Dr. Cartwright said, that it's really key to understand that this council is certainly bound by what I'm about to say, but to some degree, the boards are as well, since what they send up is going to be reviewed by the standard. It's not enough for us to be able to, if we want to pass a rule or adopt a rule, it's not enough to be able to say, well, it doesn't hurt anything, but we really can't tell that it helps anything. You have to show that if this thing is imposing an additional barrier, i.e. a cost or some other mechanism that keeps people out of the profession or possibly keeps them out of the profession, you got to basically show a need for it. And you got to have evidence to support that need for it. That was both a sunset management action requirement, and that is in our rules. That's in part of the anti-competitive analysis that BHEC has to do. And to me, that's where we've got a problem, I think. I have struggled a lot with that, because it's not enough to say, well, it's a tie. No, it's like winning a lawsuit. You got to show by preponderance or clear commitment. You got to get over the hump to get there. And I can't find anything. I'm not aware of anything that gets it over that hump.
And this is why we're stuck. This is why we can't move to do this. Even if I got over I said in my letter, I'm not putting on the agenda any item to advance ECCC2. Even if I got over it and said, all right, let's do it. Let's put on, let's buck up and let's do it. It's still going to run into that buzzsaw right there that Daryl just said. Then BHEC, as this board, has to say, okay, we're just going to like suck it up and do it anyways, and like expose ourselves to all sorts of potentially anti-competitive problems.
Your whole purpose is to do that. That is what you were created to do.
Yeah.
You would be going against your some of the core tenets of why you were created if you did not do that type of an analysis. You are here to, I'm sorry, but you're here to kind of grade the homework that comes up from the member boards to make sure it stays within those 3 lanes. And make sure it's not anti-competitive, it's administratively consistent, and it doesn't violate any good governance concerns. You have to do that. That's your function.
The other thing I was going to add, Dr. Cartwright, I was here right on the tail end of getting, I got onto the board right as we were getting rid of the oral exams. I remember the testimony, and everybody was proclaiming that it was psychology was going to hell in a handbasket. There's gonna be all sorts of crazy, poorly qualified people. It's going to be terrible, and none of it came true. So
yeah.
One other thing too that one of the things that is worrisome for especially folks that are SIPAC licensed, is that we have the ECCC standard as sort of the national standard, the ECCC1, and if we have to get rid of the ECCC1 because we don't adopt ECCC2, that's an issue that then comes into our licensing for SIPAC and like having that national, I mean, is a state, would we still be able to meet the qualifications for SIPAC if we didn't have an EPPP1? I mean, I don't know what happens there. So it opens up a lot of concerns and a lot of like sort of outside the box issues that we may not see just right at face value that, you know, we got to think about. So, I mean, there's just a lot to it, and it is a big issue for us. And I'm glad we can have discussion about it. But I do think, to Daryl's point, you know, is there a preponderance of evidence that shows that this is like helping the profession? And again, it kind of comes back to that debate. And I mean, I would love to see, I really hope that fellow psych board members start to speak out a little bit more and let us know in public comment, or however it may be, however you do that, to just let us know what your thoughts are, what your feelings are about it. If you have insight, we can, you know, strengthen numbers too. Just, it's good to know where people stand and to get the public perception too of what's going on here and what the implications might be. There might be things that none of us are thinking about right now. So
Yeah.
I
so to the
strongly
board-
urge you to make comment and to let us know where you stand.
And to the board, I want to just say thank you for listening to this discussion and kind of coming up to speed with us. This is on our doorstep, and by extension, it's coming to BHEC's doorstep. And I would hate to be explaining this to you for the first time, like 6 months or 12 months from now. And also, go ahead.
No, I would want to ask, what if the psych board decided, yeah, we're gonna adopt this EPPP2, and then it comes up to BHEC and we voted it down?
Yeah.
Where would that leave you guys?
If ASPPB doesn't blink, and if they're still hell-bent on making it mandatory to adopt EPPP2 or lose access to 1, we would be left without a test, and we'd have to be scrambling.
Then you're in
Either-
violation, because statute
Yes.
reads, it's
Yes.
not this test, it's a
A
test,
test,
but there's not a comparable alternative.
correct.
All right, so
And-
I mean,
yeah.
the lawyer the lawyer alarms are blaring on this, because it's like we're being forced by an organization that has had 7 states adopt it, that's now forcing all the other states.
And Canadian and
Because
provinces.
and there's only one option.
Correct.
Correct.
Okay, well, my concern is we're getting drawn into inadvertently into a anti-competitive liability situation.
Yes.
That's
Yes.
my concern.
Absolutely.
Okay,
There are major anti-competitive concerns here with this. Yes.
okay.
And it's provincial boards too. It's not just the 50 states. It's Canada, it's territories, islands. It's not just the 50 states. And this, to me, I mean, the way that we regulate professions like this, it is archaic when you look across like a patchwork of 50 different things. But this is how America works. Like, states are laboratories that we can respond to the individual needs. I've talked to other states, and it's interesting in terms of how their regulatory structure is different, how their board power and makeup is different. And I'm like, okay, I get it. This is how you guys are set up. This works for you guys. That wouldn't work in Texas for a number of reasons of just how our government is structured. So this cram down thing, that one size fits all, what's good for a Canadian province to say is good for Texas? No. And that's candidly my ask of ASPPB, make it optional, because there are some states based on how they're set up that may have not as stringent postdoc or internship stuff. Maybe this works for them, but they should have this on their menu. But to cram it down our throats.
And I will say, you know, for the public listening, you've heard us talk about, you know, is the exam, we've heard concerns about the anti-competitive aspect or the barrier aspects that the new exam would require. You've heard concerns about disproportionate impact on minority or immigrant populations. You've heard concerns like Chair
Does it
Hallbauer
even
mentioned,
work?
is it a valid exam? You know, does it do what it purports to do? Those are just concerns we have. You at the public, we all arrive, I think we're all kind of getting to the same conclusion. There are different routes to get there. So what I'm trying to say to the public is, you don't necessarily have to agree with any of the things any of the routes that we have said here today. You may very well have some other reason that you agree or disagree with the exam, and that's fine. But I would ask, like what Chair Linwood said, I would ask that y'all share those with us. I mean, this is one of those areas where we're kind of dying for a little bit of stakeholder input here, folks. I told you earlier, y'all are good about responding. We need to hear from y'all on this, please. I mean, because we're just up here operating off of what we know from our viewpoint. We need to hear from y'all on this. So do not be shy. You're not going to hurt our feelings. Let us know what you think.
In their defense, I don't think we haven't put like adoption of E2 on the agenda for good
True.
reason,
That's true.
but,
We need
you heard it
we need
here.
another exam.
That's,
There needs to be another
That's-
good exam up there.
that's been discussed and when you follow that discussion to its logical conclusion, it's funny because you get right back to ASPB. It's like, if there was only a national organization of states that could get together and figure out how to write this test. Oh, wait, we have that. And that's where ASPPB, and in their defense, which I won't say a whole lot, that you won't hear me say that very often these days, but in their defense, in some conversations that I've had, the admission has been made, they do want to be a bottom-up organization and not a top-down one. And I think we have some work to do.
Yeah.
If that's the goal, but they have, I will take it at face value. If that said, I will, if we can work in that spirit, I think Texas, raising our hand, we have some issues here. And we need to solve this. And that's the other thing, we have the runway ahead of us to solve this thing. If we sit around and don't talk, we're gonna run out of runway on January.
That's why we're
1st,
doing this now.
2026.
This is not fear mongering we're not trying to stir something up just for the stirring it up. It's just 2 years is gonna go by real quick, guys.
And that's the other thing, how many legislatures, in provinces have have a regular session 6 months every 2 years?
We'll have one option. There's one legislature between now and when this exam requirement kicks in, and that's the 89th. That's it. So if there's some sort of statutory fix that has to be made, you'll have one shot at it.
And we know how I'm gonna pick on the legislature. Look how hard it was for them to do property tax this year.
Yeah,
And that was something that we all agreed on, so.
yeah. Yeah, that's a good point. Yeah, that was an agreed upon goal.
It's just,
Question for you, Daryl. So I know our state legislature meets once every 2 years, but is that the same with every other state? I'm just not as familiar with other
No,
states. So,
no.
it's like,
That's
that would be
rare.
the issue, is that this is a national issue. This isn't just even a state by state. It's kind of a national, with all these other states probably having the same question. So that was my question. Even if we came to a conclusion or things did move forward in legislature, then, another state might be off schedule, right? And
Yeah,
It just-
no, every state, they do it several different ways. I think probably, I don't know. I know a lot of states meet annually. Some states do like we do, meet biannually. Some states meet biannually. 1 year they handle budget, the other year they handle everything else. There's just this hodgepodge of how it's handled. So you can't say that how we do it is how it's handled across the country.
right.
Well, again, I'm always available for questions on this. Thank you for the time. There was a lot of time on that. Moving on, sorry, your recommendation for agenda items for the next council meeting. If there are any now, you can speak up. If not, you can always email Chair Conseco or Daryl.
Yeah.
All right, and now we're gonna roll into public comment. Public comment is limited to 3 minutes per person unless otherwise directed. So right now it's 3 minutes. And please note that we may not discuss or take action on any matter raised during public comment, except to decide whether to place the matter on the agenda for a future meeting. Anyway, go ahead.
Chair Williams, before we start public comment, is Ms. Gentry, are you in the audience attendees right now? If so, we will let you go first so that we can get you heard about the application that was discussed earlier.
And they raise their hand.
I'm not seeing anybody by that name, so I'm going to assume not. And for the record, council, there was one written public comment that was submitted. It's in your meeting materials. It's actually directed more towards Chair Brumley's board, I think, than the council, because the council doesn't have the authority to address the subject matter of that comment, but we'll make sure, Chair Brumley, that that's directed to y'all at your next meeting. That way you have it to look at.
And if Ms. Gentry wants to submit a public comment after the fact, that it just procedurally gets tacked onto the next meeting, like that's
Yeah,
okay
she
too.
can.
That
Yes,
would invite
yeah.
her to do that if she feels
Yes, sir.
so inclined.
All right, so starting out, there's screen name of CT. CT, do you have public comments you'd like to give?
If you'd state your name and where you're from for the record, please.
Good morning. Can you hear me?
We can.
Yes, sir.
Okay. I'm not sure why my video is not working. I'd like to, obviously, for you to see me. My name is Cody Taylor. I was here at y'all's last board meeting and discussed a couple of things, and I'd like to put a couple of items into your ear. Dr. Taylor, you made a comment of how many people are actually looking at the rules and statutes, right? Y'all go through a lot of experience, a lot of training. I can tell you this right now. I'm on a lot of public media or social platforms, and the public is reading them. I think that in my extensive presence of being here with y'all and the LPC board, you can tell that I'm somewhat familiar with what I'm talking about. The public is starting to read this, and not because we want to. I never knew that this existed until it affected me personally. So the public is watching what y'all are doing. It's also watching what their own professionals in their area is doing. We talked about a House Bill 4062 under Texas Family Code 107.112 Section B-1. It now has the audio visual that a child custody evaluator is supposed to keep. However, in your 681.53 under your Texas Administrative Code, I do not see that in there. So I don't know if that's something that needs to be addressed and put into that, but it's not under your Administrative Code 681.53. I know that it says to follow all underneath 107, but I do think that that's a very big rule change that possibly could be put in there. I also am looking at a couple of things under 681.205, which deals with your sanctions. I think that a licensed professional counselor or marriage therapist or anybody else that makes recommendations that did not do a child custody evaluation should be subject to a higher sanctionable penalty. If you get to G where they make recommendations, which has happened in my case, it's only level 3. I think when you start taking children away from parents without doing the proper background or evaluations, and you start recommending that to the court and the court takes that recommendation on, and then it becomes false, which it did in my matter, that should be more than just a level 3. I think that should be moved up at least one notch to at least a level 2, 3, and 4, and that going from G, F, and E. Also, I don't know if you're aware, but now you have professionals who are suing civilians or citizens for this right here, engaging y'all. Y'all are a government body. Y'all are a state agency. I am bringing forth the problems that are happening in the public's eye. The issue that I have is that now I'm being sued for bringing these problems to you, which I have a First Amendment right to petition the government. So, and having free speech. I don't know if y'all are aware of this, but this is happening across not only our state, but across the other states where professionals don't like their dirty laundry aired out to the board. And now they're seeking legal ramifications against the civilian who brings that to y'all. I noticed, Ms. Smith, that kind of jars a little bit to you of what you're hearing, but I am now being sued for what I'm bringing forth to y'all and the legislation for what I'm doing. I have 30 seconds. Okay. The last thing that I would state also is that the stakeholders, the biggest thing that I would say is the public is the stakeholder, right? Y'all's integrity is to keep our public trust into what y'all do. Right now, I can tell you as far as it dealing with family courts, child custody, adoptions, we don't have a lot of faith in the professionals that are going through there. I talk to many people on a daily basis, weekly basis, and there's not a lot of faith in the public on what is happening in y'all's board. Again, I see nobody underneath 681.53 that is being reprimanded or any of the marriage family therapists that are going through the courts, making recommendations and testifying.
Taylor, thank you so much for your time. To be fair to the other individuals waiting for their turn to speak, we do need to enforce that 3-minute.
That's not a problem. I have a lot. 3 minutes is not a ton, but I appreciate it. I hope y'all are taking what I'm saying into consideration. Thank you for your time.
Absolutely. Thank you for your time. Also, you can feel free to send an email itemizing the items that you would like to be reviewed.
Yes, sir. Thank you, Dr. Taylor. I will do such.
Thank you, Mr. Taylor. Appreciate it.
Ms. Martin, did you have public comments you wanted to give? Ms. Sandra Martin?
Can you hear me?
Yes, ma'am.
All right. I'll make this short because I have a client hovering outside the door here. I'm Sandra Martin. I'm a governmental liaison with Christian Counselors of Texas. There were two things that caught my attention that we'll be wanting to pursue as much as we can in between board meetings. One of them was the issue of poor Ms. Gentry. That just shouldn't happen. I mean, we have this wonderful first class in our professional counseling program. Why is that not being told to people? Why are they not dealing with that? One of the things we're doing is pulling together our educators across the state of Texas that are part of Christian Counselors of Texas or want to be, and that certainly will be a subject discussed. The other is the psychology issue. That's a bigger, much bigger issue than we, so states and being forced to do things and things of that nature. So we are talking about that as well pretty deeply and wanting to pursue that pretty deeply, wanting to pursue that in great depth, as a matter of fact. So you'll be hearing from us both in writing and in begging for interview times and talk times and things like that. So thank you very much for the work that you do and the service that you do. We're out to support you. We probably won't like everything you do, but we do want to support you, and we can be courteous in that. So thank you so much, and next time.
If we did everything if we made you happy all the time, we probably wouldn't be doing our jobs very well. Thank you for your comments.
Thank you, Sandra.
Thank you.
NASW Texas?
Yes, this is Will Francis, and I represent NASW Texas, Louisiana, and I want to thank you for the opportunity to speak today. I really appreciate all the discussion today. I would continue to make a request. It really, I think, would be beneficial to have the board, BHEC, open up public comment during any areas where you're voting on rules or where you're voting on areas. I just think having the ability for the public to jump in, provide comments on areas that you have now voted on and are is important for transparency. I very much understand that you all do a wonderful job discussing these issues. You really get into them, but I just think at that opportunity, you really draw people in to help shape rules in a way that maybe not everyone is always aware of. So I would just continue to ask that. In addition to that, I appreciate the discussion about Ms. Gentry. There was a recent article in the Houston Chronicle around her. This is an area that we hope to focus on. It is, as you all know, only the psychologists and the social workers that are affected. The LPCs and the LMFTs are not. And so we hope maybe that expert testimony can be provided through this agency as a resource witness in the future, since I know one of the main charges of this agency is to align the rules overall. I definitely support the technology in the ASWB rules. I really support 882.23. that allows social workers from other states who are licensed here and currently here physically to provide services out. I think that is mandatory. I want to thank Daryl Spinks for explaining the rules so well. And then lastly, just a big shout out to Brian Brumley and Sarah Fassholtz for appearing at our conference and for doing such an amazing job of engaging with members. I really recommend all of you to go to any conferences you can like that. It is so important to the public. They report back to us that they so appreciate the ability to ask questions, to engage, to sit in sessions. So I just really want to say thanks to BHEC for all of the engagement you all do with the public. I know how important that is. Thank you for letting me speak.
Thank you for your comments.
Dr. Sartor, do you have public comments you want to give?
Yes, I do. Thank you so much. Good morning, everybody. My name is Dr. Terry Ann Sartor, and I'm a licensed professional counselor, supervisor in private practice, a counselor educator, and the liaison to BHEC for the Texas Counseling Association. I am grateful for the opportunity to serve on the BHEC Rules and Standardization Committee as well. TCA does appreciate the council for allowing stakeholders to make public comment and express concerns and appreciation of to the council and individual board members. When new rules are being adopted, TCA does encourage the council to take public comment before taking action on the proposed rule changes, though. On that note, TCA would like to thank Mr. Speaks for clarifying the rule changes related to 507.258 of the occupations code, which relate to the occupations code. And we also appreciate the adjustments made to the other rules that were based on public comment from the August 15, 2023 meeting. TCA appreciates the efforts taken by BHIC, the executive directors, licensing board members, and the staff in highlighting issues and laws supporting mental health needs of Texans. Additionally, thank you for sharing the list of significant accomplishments of BHIC in the public meeting materials. This list was impressive and further displays the efforts of BHIC and staff in supporting individual member boards, licensed mental health professionals, and the public. TCA supports the Texas State Board of Professional Counselors' decision and the council's support to delete the requirement that an applicant must receive a passing score on the NCE or National Clinical Mental Health Counseling Examination within 5 years of the date of application. Removing this requirement will further assist in eliminating barriers for those seeking licensure as an LPC associate and further promotes rural consistency with the other mental health licensing boards in Texas. TCA continues to support the decision of BHEC and the Texas State Board of Examiners and Professional Counselors, and acknowledging those who have earned a doctoral degree in counseling by including it on their license. As mentioned in the prior BHEC meeting in August of 2023, this ensures consistency with TAC 681.49D and TAC 882.31, and TCA encourage continues conversations concerning parity of mental health licenses and degrees associated. As a reminder, TCA will be hosting its 67th Annual Professional Growth Conference, November 1st through 3rd in Houston. Our members are excited to interact with the board members and executive directors who will be present. Additionally, we are appreciative that the Texas State Board of Examiners of Professional Counselors and Texas State Board of Examiners of Marriage and Family Therapists board members have scheduled presentations to share board news, current trends, and answer questions related to licenses and practices. Lastly, we appreciate the diligence of the members of BHEC and all licensing boards in working toward having consistencies across licensing board rules. This continues to provide clarity for mental health professionals, the staff members of BHEC, and the individual licensing boards and public who seek mental health services. We truly appreciate and respect all the hard work of our volunteer boards. Thank you for listening, and we appreciate your time and dedication.
Thank you very much.
Thank you.
There are no telephone callers, Mr. Chair, and there are no other hands raised.
All right. I want to thank everybody and members of the public for sticking around and for providing that input. We hear you, and definitely all will go into consideration. There's no other comments. Entertain a motion to adjourn. It's been moved. Second.
I'll second.
Without objection, this meeting is adjourned.
Thanks, everybody.
Appreciate it.
Thank you.
Bye, guys.